This is a philosophical examination of the internet's capability to transmit ideas internationally, titled The Underlying Cause of Manic Depression. This video is to explain the underlying causes of manic depression bipolar. I'm hiding my identity as a precaution. This is just what I think most people should do when they're using the internet. A lot of doctors and professionals have researched the underlying causes of the disease because they are convinced that it is a hereditary cause, and as of yet none of them have been able to explain where the underlying causes is from. They're not sure if it's something to do with the genes or if it's an external factor, but after a lot of research, 6 years of research, I've been able to decide and decipher and come to the conclusion that there is an underlying hereditary cause. The cause, as like with other diseases, is hereditary because it's a genetic intolerance to a certain external factor. As some people are lactose intolerant and have an intolerance to lactose, and as some people are gluten intolerant and have an intolerance to gluten, there are also people with a yeast intolerance that have an intolerance to yeast. It is the people with an intolerance to yeast that are affected and are diagnosed as bipolar. I know this might sound very far-fetched, but if you allow me to explain myself, I'll give you all the symptoms, and eventually you'll come to the understanding that it is an intolerance to yeast that causes manic depression. It's a well-known fact that people with manic bipolar depression are often diagnosed as young adults and as late teenagers. And there's little coincidence to that when you understand what is causing the disease. So let's look at the ages when people first come into contact with high dosages of yeast. Yeast is part of our natural diet. It's in many foods, and we consume the yeast and it doesn't affect us until we're older. And the reason for that is it's not until we reach late teens and early adulthood that we start to consume huge amounts of the yeast bacteria. So let's look at the first ways that people can become infected with the yeast bacteria. Yeast as a bacterial infection can first infect the host, i.e. the patient, in the ages in late teens when they begin to have sexual intercourse. And this is because the yeast infection can be transmitted via sexual intercourse. It's commonly called thrush, and it's a genital infection of yeast. It's a yeast infection, and it goes from patient to patient because often there's little symptoms. It's not until the itchiness and the rashes begin that the patient is aware that they have the infection and that they can, and it's not until that time that they go to the doctors and ask for a prescription for a topical cream to have it removed, and in extreme cases they can even have pills to have the infection removed. The symptoms are not so easily observed in men because the symptoms aren't as easily observable as they are in women. Often thrush is more common for women to discover that they have thrush than for men. And this is a well-known cultural thing. Most women are aware of thrush, whereas most men generally aren't until they catch the actual infection. So that's the example of the earliest ways to catch the infection, usually beginning at the ages of 16. Most people in the West culturally are allowed to begin having sexual intercourse, and that's when they can first come into contact with this bacterial yeast infection. In Europe and other Western cultures, at the ages of 18, young adults and late teenagers are allowed to begin to start drinking alcohol, and they often do it to excess with the fervor known as binge drinking. They binge drink huge quantities of alcohol because it's become legal for them, and they begin to consume it to excess because it's a thrilling way for them to come to terms with adulthood and to also alleviate the stresses of that age. So in America, they also begin to start drinking at the age of 21. So it's in the early adulthood and late teens that people in the West begin to culturally consume huge amounts of yeast as a result of binge drinking alcohol. So when you put those two factors together, the sexual intercourse at the ages of 16 and 18, and binge drinking alcohol at the ages of 18 and 21, it's little wonder why so many people are infected with the bacterial infection at that age and during that time. A huge, a huge factor to that initial stage of infection is that as the body experiences high amounts of stress, the body's ability to protect itself, its immune system is lowered with high amounts of stress, which makes people more prone to catch infections and colds, etc. Which is why at the ages of 16, when people are transitioning into adulthood, and at the ages of 18, where people are transitioning into the workplace or into higher education, and at the same time are being made to leave their homes for the first time very often, it's one of the main reasons that they experience high stress, and it's also one of the main factors that they become more prone to the infection of yeast, combined with their renewed vigor of consuming high amounts of yeast-based products, and whilst having sex at the same time. So when you include all the possibilities of catching a yeast infection, and you include the high amount of stress that people are undergoing through that time, and then you add to the factor an intolerance to yeast, it's very obvious why people are becoming infected with yeast bacterial infections. So what does this mean to people with bipolar? Well, what it means is that their body is being attacked by a bacterial infection, and the result is manic depression. And let me allow the explanation to educate you about why you're becoming manically depressed. We'll begin by first talking about the symptoms of the bacterial infection. The first symptom in patients is a dizziness. It's a feeling of dizziness and feeling faint, as though you're swooning and about to collapse. And the reason for that is because the bacterial infection has begun to consume the sugars within your body, because the yeast bacteria feeds off of sugars. So as you become infected, the first symptom is dizziness, as the yeast bacteria begins to feed off of your sugar within your diet. And as it feeds off of the sugar, you actually begin to lose the sugars. And so as you lose the sugars, you become faint. And the faint feeling leads to dizziness. The dizziness often, when people visit the GP or the doctors, is attributed to panic attacks. And the reason for this misdiagnosis of hyperventilation is because when people become dizzy and faint, they panic, they don't understand what's happening to their bodies, and so they have hyperventilation and they have panic attacks. And when they visit the doctors and explain all the symptoms, I was feeling dizzy, I was feeling faint, I couldn't breathe, the doctor says, well, it's very obvious that you're having a panic attack, which then allows patients to realize that they're having a panic attack, and psychologically the next time they feel faint and dizzy, they tell themselves this is a panic attack, and so they calm themselves down, although that doesn't stop them from feeling faint and dizzy. But as that faint and dizziness passes, either from eating food or from resting, the patient believes that it was a panic attack or a spell of dizziness, and so they feel okay and they continue with their day as though nothing happened. And that's often the first symptom of bacterial infection. The second and most obvious symptom of the bacterial infection is a dark or a light shading of brown around the eyes, generally around the bottom and the sides of the eyes. And a lot of people, when they see that, they think of either hay fever or some sort of allergy like that, or they think of a lack of sleep. But it's often incorrect to think that. It's the people with the brown and light shade, the light brown shading, often can have more than 10 hours of sleep a night and still wake up with the brown shading. Whereas people that have a lack of sleep, they don't actually get a light brown shading. They get more of a grey blue shading as a lack of sleep. But when people see the shading around the eyes, they often attribute it to allergies or to a lack of sleep. But it's actually a very common symptom of bacterial yeast infection. More very obvious signs of bacterial yeast infection include yellowing around the fingernails and on the toenails, and also very obvious infection symptoms of infection is thrush, genital thrush. There's also oral thrush, which is a whitening of the tongue, and it also includes a feeling of similar to a nasal drip of a lot of mucus in the throat, and that's symptoms of oral thrush. And in very severe cases, there's also infection, a bacterial infection of the lungs, and this can lead to death. But it's only in extreme cases when the body has been completely overrun by the bacterial infection. It infects the lungs, which can lead to death. So all of those symptoms exist, but the first form of bacterial infection, yeast bacterial infection, is the gut infection, and that is usually from consuming foods, because it's in the gut, it's in the core that the infection first begins to feed off of the sugars. So it's within the core that the infection really has its crux and where it's getting most of its nutrients from, i.e. the sugars and the glucose within the body. It's feeding off of the sugars from the diet. So what does this mean for people with manic depression bipolar? Well, often when an adult has manic depression bipolar, their child has a possibility and a chance of having the disease themselves. And this is what leads a lot of doctors and professionals to believe that it's a hereditary disease. But most of the doctors have been looking for the genetics and have been scanning brain functions and trying to understand why a psychological disease is being passed from adult to child. And very few of them are looking at the external factors, which is probably why it hasn't been discovered yet that the disease is being caused by an infection. And this is because the disease shows so many psychological symptoms: delusions, psychosis, paranoia, all these things that, like, emotions, mania of emotions, and then emotions of depression. It's made a lot of doctors focus on the brain functions and to focus on the genetics of the brain. So this then leads me on to talk about the yeast bacteria and how it's effectively causing manic depression. Now, when you think about yeast bacteria, its most common use is in the fermentation of alcohol. Yeast ferments sugars into ethanol, and that makes alcohol. Well, that's a simple way of explaining the process of fermentation. When yeast consumes alcohol, when yeast consumes sugars, the waste product is alcohol, ethanol. I think yeast can produce 16% of ethanol before the ethanol poisons the yeast, and that's why most wines and beers and things can only reach 16%